everyone. For the longest time, I've been wanting to do a podcast about skincare. If you're anything like me, I am super overwhelmed when it comes to skincare. I keep it really simple, partly because I'm not sure what's evidence based and what's just a waste of my money and what's actually going to make a difference, what's safe for my skin. And so I wanted to have an expert on that was evidence based. And Amy Koberling is the perfect person for this. She is a dermatology PA. She is evidence based, but she likes to keep things really simple. So, in today's episode, we talk about how exercise affects your skin. We talk about how you can keep your skincare really simple and the three primary skincare products that she recommends everyone use, which was really helpful. I'm going to go get two of them today. We talk about why skincare is more than just aesthetics. We talk about treatments like micro needling and lasers. We talk about filler and Botox and her opinions on that. We talk about diet and why diet is important for your skin and how it can kind of like buffer certain pollutants and external environmental factors that can ultimately cause aging of our skin. So, very informative episode. I learned a lot. Without further ado, here is Amy. Okay, so I'm so excited for this one because this is the first skincare episode that we've had, and I love your approach to things. So let's go into just the first question. My audience is exercise focused. And what does the data say about exercise and how it affects your skin?
So it's very interesting because I think up until recent years, the dermatology world was very skeptical about any kind of changes that we might see in the skin based on diet and exercise. But we're realizing in the last 5 to 10 years, there's more and more data mounting about the benefits and the not so benefits of certain lifestyle aspects. And when it comes to exercise in general, we know that any sort of exercise is beneficial for skin health, right? So whether it be aerobic training or resistance training, both are going to be beneficial because they're going to increase blood flow to the skin, just like they increase blood flow to the rest of the body. So you're going to see an improvement in the dermis in both, which is the lower part of the skin where kind of our structural proteins are. Again, you're going to see that increase in vasodilation, so more blood flow to the skin. But specifically, more recently, what we've learned is actually that resistance training is even more beneficial than aerobic training. It actually increases the thickness of that dermis, which again is where our collagen and elastin is. So we can conclude basically that through resistance training, we actually help our skin to look more youthful, again, by thickening that lower part of the skin. That's so important as we age, because as we age, our fibroblasts, which are our cells that are responsible for the elastin and the collagen, which give our skin that bounce and the youthful plump and appearance to our skin, they start to kind of get lazy and they don't do what they're supposed to do. So anything that we can do, including now having resistance training in our arsenal to increase that thickness of that layer of skin, it's going to eventually lead to a more youthful appearance.
You know, I love to hear that.
Yes.
Resistance training, just another benefit of resistance training, which I think is just helps people stay consistent when they have all of those little reasons. It's like, yes, you're going to feel better. You are going to improve your body composition, your longevity, but your skin's also going to be more youthful, which I think is so cool. When I talk about anti aging a lot on like the podcast or in social media, a lot of people have some resistance to that and think that it's all about aesthetics. But I like to say, and I would love for you to speak to this more, skincare isn't just about the aesthetics of it. It's not just about how you look, because skin is our largest organ. So, can you speak to that about why skincare is important for more than just the aesthetics?
Yes, exactly. There's so many reasons, but let's start with what you said. The skin is our largest organ. So we want to keep it youthful, and not just the sense of we want it to appear youthful, but just like we want the rest of our organs to be as chronologically young as possible, right? Because that's what's going to give us longevity and that's what's going to help us to age well into our later years. And I'm sure you can echo this. You know, we all want a long life, but we also want a healthy life. And that's really what is most important to me at this stage of my life. I want to be here for decades, but I also want to be here happily and healthfully in a way that is sustainable for me and for my family. So kind of getting back to skincare, it is so important that we look at our skin as the organ that it is, that we kind of care for it, that we protect it from the environmental aggressors. So just like we know how much our environment nowadays is impacting our overall health, right? We're seeing it in staggering numbers with the increase in chronic disease and all of the other kind of really sobering statistics that we, all of us in the wellness space who have an interest in health, are kind of seeing every day. The same thing is happening with our skin. So we're exposed to so much more now than we ever were. And all of those environmental aggressors are wreaking havoc on our skin. So when I use the term anti aging, I really mean it in a holistic way, meaning it's not just about fine lines and wrinkles, right? Of course, that's one benefit of it. But when I see patients, my medical assistants know, when they'll tell me before I go into a room, like, just so you know, lifestyle is definitely a factor here. And what they're telling me is the history that they got from the patient based on their, like, the way that they live their social lives, and what they're seeing on the patient's skin is matching up, meaning the alcohol, the smoking, the sun exposure, the lack of sleep, that's all starting to add up on the skin, and the patient is coming in with those concerns. So while of course I'm going to treat them and have those conversations with, what can we do topically, maybe even more invasively, what can we do to address their concerns, really there's kind of not a point in investing in all those things if you're not also investing in your overall health. So kind of what you said earlier, like whatever, there's so many reasons to do resistance training. I always tell people there's so many reasons to get healthy, and whatever the reason is that makes it click for you. Like I recently saw one of the bloggers I follow, she is into tennis and so am I. And she was saying how finally it clicked for her weight training, that it was helping her tennis game. And so that's what she needed to give her the encouragement to continue on with weight training. So whatever it is for you, if your skin is what really gives you the encouragement to adopt a healthy lifestyle, I think that that is such a win. And you will see those changes as you start to adopt those little changes in your life.
Totally. I like to call those things like the low hanging fruit. And it's not necessarily low hanging fruit because changing behavior around exercise and food is not always easy, but it's going to have, and sleep, but it's going to have the biggest impact on your health. And I think skin is no exception. Let's say someone has those things down. They're sleeping relatively well, they're exercising, they're eating relatively well. What are some things that people can do beyond that to improve the health of their skin?
Oh, there's so many things. Starting with a solid skincare routine. And I am somebody who likes to keep things simple. I, like you, am very evidence based in my approach to overall health, but also skincare. So I want to make sure that whatever products I'm using or my patients are using, they're actually going to pack a punch and there's evidence to support their use. So that's going to be things like daily sunscreen. That's the most important thing that you can do for your skin. Hands down, if you're doing nothing else, a daily sunscreen is going to, in 20 to 30 years, make such an impact on your skin. Vitamin
And
C.
what SPF, sorry, what SPF of the sunscreen do you recommend?
At least 30 for daily use. And then you want to make sure, if you're somebody who's outside a lot, that you're reapplying. If you're living most of your life inside, you probably don't need to reapply as much. But if you're somebody who is outside for work, or you like to go on walks a lot, or you're, head to the beach after work, whatever it may be, park with your kids, reapplying is really important. So SPF of 30 or higher plus reapplication, those are going to be more important than trying to strive for like an SPF 50 or SPF 100.
Got it. Got it. Okay. And then vitamin C was next.
Yeah, vitamin C and then retinoids. So I like to think of those as kind of like the trio of evidence-based skincare practices. There are many other, especially in the last 5 to 10 years, that you've probably heard of, things like peptides, things like growth factors, niacinamide. There's countless ingredients that do give our skin a benefit. But if you're somebody who's kind of just starting, those three for sure are going to give you an impact, not only relatively shortly, but long term, which is what we're really striving for. And then once you have that down, there are so many things you can add into your routine, kind of depending on your budget and how into skincare you are. Like, are you someone who wants a 30-minute routine at night? Are you someone who's like, no, I just want to slap on these 3 products and go to bed? You know, if you're doing those 3 basics, that's going to be the most important. But there are things that we know evidence tells us can help with anti-aging, like red light therapy, like microcurrent. So if you're looking to amp things up, there are some things you can do. And then, of course, kind of making tweaks to lifestyle, even if you think you're doing everything right. I'm sure you can relate. I've been in that boat where I kind of thought I was doing all the right things, only to realize that actually the research says that I could have changed a couple of, little tweaks to make my life a little bit healthier. So things like making sure you're getting enough protein. There is some evidence that collagen supplements can help with dermal thickness, with elasticity and hydration and things like that, which kind of beyond 5 years ago, nobody really thought there was any evidence there. So collagen supplements can be helpful. Eating diet high in polyphenols, antioxidants, a lot of the stuff that we recommend for overall health, healthy fats, all of those things, making sure that you're incorporating those into your diet are really important.
I love that. You mentioned those top 3 topicals.
Mhm.
Do you do those at both morning and night? Or I'm always confused about this, or just morning or just night?
Yeah. So when I say those three are most important, those are kind of the heavy lifters in your routine. Of course, you want to also be cleansing and moisturizing. So a really simple routine would be like in the morning, you could cleanse, vitamin C, and moisturizer and sunscreen. Many of the sunscreens on the market are very moisturizing. So if you wanted to get it down to 3 steps in the morning, you could easily do that. Just do a cleanse, vitamin C, and a moisturizing SPF. Then at night, you want to get the day off, get off that SPF and any makeup you're wearing, and then a retinoid and moisturizer. So you can get great skin with 3 steps in the morning and 3 steps at night very easily.
Love that. So easy. And then you mentioned red light therapy. I've heard different things about this, and I've heard that some tools are more effective than other tools. Like there's those masks, and I've heard maybe they're not as high powered enough. And then there's like the panels. So, what do you recommend for the most effective red light therapy tool at home?
I actually love masks at home. And the
Oh,
reason
okay,
is
good.
because they sit very close to the skin. So the panels can be helpful. Again, I'm saying this broadly. There are bad masks and good masks, and there are panels that aren't as effective and panels that are effective. And there's actually certain wavelengths of light that you want to look for, which we'll talk about in a second. But in general, masks can be helpful. And I like that there's very little user error because it's sitting right on the skin. So it's exactly where it needs to be to do its job. And if you're someone who's specifically looking for the quote unquote anti aging benefits, that's going to be things like increasing collagen production, helping with skin texture, um, helping to reduce inflammation. What you want is red and near infrared light. So the combination of those two is going to be most beneficial. And then, of course, there's things like blue light for acne as well. So you can find masks that do all three. In general, the anti aging masks are going to be the red and the near infrared light. And the quality masks shouldn't be feeling hot on your skin. They already have a calculation with how many bulbs they need based on how many bulbs are in the mask and the wavelengths that they use, and then they come up with the amount of time. So people always ask, how long should I use it? You should use it for as long as that mask says. Usually they shut off on their own. So there are really good brands on the market. I'm always asked about more budget friendly ones, and I think as the technology starts to catch up, we will see more and more budget friendly ones. But in general, the ones that I've seen that are on the lower end aren't going to be as effective. So it's really one of those things. Is it absolutely necessary in your routine? No. If you have it in your budget, then go invest in one of the better masks so that you can actually see results.
Do you have a brand that you recommend?
Yeah, there are a few. I really love Current Body. I really love Omnilux. Omnilux is the one I personally use. It's super comfortable. It's flat, so it packs very easily. And there is a small cord, but it's pretty portable. Like you can kind of just put the cord in your pocket and walk around the house. It's only 10 minutes. And I go on with my night. Like I do my chores, I do whatever I need to do. Sometimes I'll meditate with it on. So it really, for me, there can't be that barrier of time because like you, I'm sure you have a little one too. Like our time is so limited. So I need to be able to multitask while I'm using it, which is why I love that one specifically.
Yeah. And this is like an every night thing. Is this your post makeup? Like everything's off, your retinoid's on, and then the mask goes on last, like before bed? Or can you do it with your makeup on?
So I actually do it on clean skin. So
Okay.
it's my step after cleansing. So I've already double cleansed all makeup and sunscreen off. I do my mask, do it for the 10 minutes, and then after that I go on with the rest of my nighttime routine.
Love. What about skincare treatments like lasers, microneedling? What does the science say about these things? Do you recommend them? Where do you stand on that?
Yes, they can absolutely be helpful. And many of them kind of work by the same mechanism, which is controlled injury in the skin. So when we have an injury to the skin, our skin responds by increasing collagen. So like microneedling, we call it collagen induction therapy. And we're creating that controlled injury with those little microchannels into the skin so that the skin responds and says, oh, wait, we have something going on here. We need to send our energy here to create more collagen. And that's how we get the anti-aging effect. Lasers in general, there are lasers to treat so many different types of things. And I think it can be difficult to give kind of an overarching yes or no on those. I personally have a history of melasma. I hyperpigment very easily. So I will almost never laser my skin for any reason. So I think sometimes people think that they are safe in the right hands, but you have to go to somebody who knows what they're doing and somebody who's willing to tell you no. If you're somebody who hyperpigments easily or you have a deeper skin tone, you have to be very careful with lasers. Microneedling, of course, there's risks and complications with as well, but it's one of my favorites, especially for people who are a little bit younger who have good skin integrity already, because we know that 3 to 4 treatments can increase collagen by 400% in the skin, which is a huge number for something relatively easy. I mean, you leave there with a little bit of dry blood on your face because the endpoint that we're looking for is something called pinpoint bleeding. So you have a tiny bit of blood on your skin that we have you rinse off the next day or that night. And then you look like you have a mild sunburn for a couple of days. Usually my patients can cover it very easily with their tinted sunscreen, no problems, go right back to work. So for something with such little downtime, the payoff is really nice in those 3 to 4 treatments. So it's something I would recommend doing like a series of them once a year, just like you go to the gym, just like you do these things at home when maybe you're not seeing changes yet, but you want to kind of get ahead of the process. That's kind of the perfect patient for those
I
procedures.
love that. Wow. I've never done it, but I've always been interested in it. What about the microneedling with is it PRP infused, or what do you what are your thoughts on that? The platelet stuff?
Yeah, so I use PRP on all my microneedling patients because we know that it is more effective when we have the platelets, the growth factors, all of those, all the good stuff that's in your blood. It just helps the microneedling to work a lot more effectively. So I almost never will do it without, unless it's someone who's really does not want to get their blood drawn, because for the PRP we have to take your blood. It's a very easy process, just like when you get your blood taken at the doctor. We spin it down and then we put it back on your skin. So it's your own stuff. I like to say we're not using anything foreign. It's your own growth factors that we're putting back onto the skin. And it does make that microneedling much more effective if we can do it that way.
Love. This is so helpful. What about filler and Botox? What are your opinions on those types of treatments?
I think there's a place for all of these treatments. I think when we get in trouble is when we start thinking that they solve everything and that they're for everybody. So we're kind of seeing the backlash of this already. It kind of started happening with the celebrities that we were very clearly seeing becoming almost disfigured, and it became really sad because we were seeing some of these big names who didn't look like themselves anymore as a result of over injection and things like that. So when it's done well, you really don't notice that it's happened, right? So your friends or people that you see on the street that have had filler and Botox, the goal is that you have no idea as the layperson, and that's what we want to see. When you start noticing work is when it's probably a little bit too much. So absolutely there's a place for them. Fillers in general can help your skin produce their own collagen as well. That we use mostly hyaluronic acid fillers to kind of inject back into the structure of the skin to give some volume back to the face. But it's not a facelift. It's not going to give you the results of a facelift. It's not going to give you the results of an implant, let's say. So a lot of people will kind of chase fillers as an end all be all. And that's when you start to get this kind of distortion of your normal facial features. So again, so important to go to somebody who will, number one, tell you no, and number two, understands the balance of the face. And, I always tell people, if someone tells you no, listen, because there is always going to be someone who will take your money and tell you yes. So if you shop around long enough, you're going to find somebody who will do it. And that might not always be the best choice. So find somebody that you trust and heed their advice when they say yes or no, as long as they can give you a reasonable answer as to why they came to that conclusion. Botox is great. It helps to treat and prevent wrinkles. So I think it's a fantastic treatment if you're somebody who's starting to see those lines set in at rest and they're really starting to bother you. Do you need it in your 20s or even early 30s? No. Your skin integrity is so good at that point that in your late 30s, when those lines really start to drive you crazy, a couple of rounds of Botox is probably going to eliminate those wrinkles altogether. So if that's the way that you want to go, you can absolutely start that at that time. I think for a long time we were recommending preventative Botox as an industry, and people, I mean, I started getting Botox when I was in my 20s. So I understand the appeal of it, right? The smooth glass forehead I totally get. But in general, I think as a provider, for me, it's best practice to wait until you're really seeing those lines that are there at rest. Everybody has lines when they move, right? It's normal to have wrinkles when you move your face. That's a normal part of our anatomy. So I think as we kind of get away from that notion that everyone needs to be frozen, we're going to start to see that change a little bit in the way we practice.
Yeah, I feel like I see a shift in like pop culture towards going towards more of like a natural face with like less Botox and less
Mhm.
fillers. Whereas like 5, 10 years ago, it seemed like there was so much filler and Botox, and even like these celebrities that were younger, like in their 20s or early 30s, like you said. So I think that's really interesting. Follow up question about the fillers. I've heard that they never truly like dissolve or go away. Is that true? Is it always something that stays in your face and moves around your face? I've heard of like this moon face thing. So what educate us on that?
So I think there is some validity to that argument. So when we see the timeline of fillers, like when we're educated, let's say as providers from the company, they'll say this filler lasts 12 to 18 months. And what I take that to mean is that that's when the patient is going to see those results start to dwindle and start thinking, "Oh, I feel like I need a little bit more." But that doesn't mean that the filler is gone from the face. And they're doing MRI studies all across the world where they're looking, and this is probably what you're referring to, what you've seen in the news, they're seeing the impacts of this filler, how long it's sticking around the face. And it is lasting a lot, I mean, decades, a lot longer than we ever thought possible. And we also know that by layering it, it lasts longer. So if you're somebody who's coming in regularly, that's why you might need 2 or 3 treatments in the beginning, and then maybe you don't need another treatment for 5 years, because once you get to where you need to be, that layering effect kind of keeps everything in place. So yes, it is lasting a lot longer than we thought. But what the little remnants that you're seeing in the skin might not ever be noticeable to the human eye, right? Then conversely, we're seeing people who are getting kind of festooning of filler, like underneath the eyes and things like that. And that's when you want to make sure that you're going in and getting that dissolved. And that's not necessarily the fault of whatever, the injector from your past. It's just our facial muscles are dynamic. Our face is always moving. So, these things do, I don't want to say move around. It's not like you're going to press on your skin and the filler's going to move, right? But over time, we are starting to see that some of this filler is going to places that it wasn't intended to be, and it's lasting a lot longer. That being said, we do have an enzyme that can quote unquote melt the filler, which is one also what makes it such a safe practice, because if it ever gets where we don't want it to be, we can melt it. But I do think that it's important to kind of keep that in mind, not only as providers, but also as patients. It might make you think twice about how aggressive you are about treating some of these things.
Yeah. Yeah, I think that's great. I've never gotten fillers before. I don't plan to, but not that I have any judgment about it, but I just think it kind of freaked me out a little bit.
Hmm.
And so I think you talking about this in a really like non fear mongering way is really nice and refreshing. So thank you.
Yeah.
Um, clean beauty. Clean beauty is everywhere. So clean makeup, or like I'm a big self tanner girly. I'm trying to get away from it. Um, Tell us about the science of this, because it seems to be everywhere. Cleaning up some of your beauty products. Is there validity to doing this, or is there a reason why we should start to care about having cleaner beauty products?
I first want to say that I completely understand where the desire for quote unquote cleaner beauty comes from, because I think there's so much happening in today's world, kind of back to those environmental aggressors, the things that we're exposed to, that it can feel scary, especially when we see rates of chronic disease increasing and things like that. It can be, we can start to feel like we're losing control, and we kind of grasp onto what areas we might have control of. But when it comes to beauty and safe beauty practices, Largely everything that's in the common products that you can find at drugstores, at big box beauty retailers are safe and are safe in the amounts that they're used. I have a lot of really good episodes. I'm not a toxicologist. I have a lot of great episodes on my podcast with cosmetic chemists, people who really specialize in safety of beauty. And we have these conversations often, like at what level, if any, is clean beauty really valid? And the first thing is that there is no standardized approach to clean beauty. So the brands, the stores that have kind of the clean label, that's based on what they have deemed clean. So you'll notice that there's variation among them. And then there's, websites where you can do like ingredient checking and things like that, which sounds like such a great idea. But then when you dig into the research that they're using to make those claims and to give their stamp of approval, some of that research, as you know, you can write a paper on anything. It doesn't mean that it's valid, unfortunately. And
Yes.
that can be really hard as a consumer, even somebody with a medical background. I'm sure you feel the same. Like, reading studies is difficult, understanding if those studies are valid and if the materials and methods were were valid. And so there's a lot of smoke and mirrors in the industry. And so I like to comfort people that in general, they don't need to be afraid of their beauty products. I think it's not one of the areas that I would focus on so much. And I would caution people when it comes to looking at these ingredient checkers and things like that, because I think that they can cause more harm than good, in the sense that they're causing more widespread fear than they need to. So as of right now, there's no standardized approach to clean beauty. So clean beauty really does not actually mean anything. It just means that that brand has deemed themselves clean based on whatever ingredients they've decided are not safe. But when it comes to the ingredients that are used in our cosmetic products, largely they are safe for topical use on our skin in the concentrations that they've been used in the product.
That makes a ton of sense. You were talking about kind of environmental factors. Do you mean like pollutants? What do you mean exactly when you say environmental factors if you're not referring to like beauty products? And follow-up question to that, is there a way to like buffer these toxins with food or exercise? Or is there a way to kind of, I don't want to say detoxify, but yeah, like improve, yeah, detoxify, I guess. I think that's a buzzword that we see a lot. So speak to that.
Yeah, I think there's kind of a joke in the medical world, like you don't need to detox your body, your liver and kidneys do that, right? Like our bodies are
Yeah.
made to detox ourselves. But I am also somebody who is a little bit in the middle on this topic, where I believe that in order for our body to properly detoxify, we have to make sure that we're feeding it the right things and setting it up for success, right? We can't expect an unhealthy body to detoxify properly. So, to kind of answer your question about buffering, I do think that eating a diet rich in antioxidants is always going to be helpful. And when it comes to environmental aggressors, what I'm speaking on is pollutants, UV exposure, like those things that we know for a fact are making an impact on our skin and our overall health. And we do know that whether it's antioxidants topically or a diet that's rich in polyphenols and antioxidants, we can support our skin and our bodies in their quest to kind of keep us protected from that, right? The literal job of our skin is to keep us protected, and it can do that if we support it the best we can. But back to our original conversation, if we're lacking sleep, if we're eating diet high in sugar, a high glycemic index diet, if we're not supporting our skin with exercise, then it's not going to be able to protect us as well as it wants to.
I love that. What are some kind of like top foods when it comes to this or just skincare in general? Like if you could just rattle off like a few that we should all have in our diet.
I love berries. I'm always a huge fan of berries because don't not only are they high in vitamin C, high in other antioxidants, but they're also low on the glycemic index. So I'm a big fruit person, but a lot of fruit does contain a lot of natural sugar, and I'm someone who's sensitive to that. So we know that diets that are high in sugar can wreak havoc on our skin in a variety of ways. Not only do they kind of eat up our collagen they produce something called AGEs, which basically our collagen starts to cross link each other and then it can't work properly or repair itself. And so we end up seeing the results in our skin, right? So premature aging from a high glycemic index diet, which is high sugar. But also we know that eating a diet high in sugar can also affect for people who are acne prone, things like that, which is if anyone's acne prone and they've noticed a breakout after eating a lot of sugar, that's like common sense, right? But for those who aren't acne prone, that might be something they don't know. So making sure that we're eating low glycemic index diet. So berries I love for that kind of twofold reasons. I love like raw cacao. I try to put that in, kind of make my own hot cocoa at home without sugar. Green tea is rich in polyphenols. What else? I actually love full fat dairy like Greek yogurt, something like that, because it's high in fat, it's high in protein. And for people who are dairy sensitive when it comes to their acne, the data says that most of the issue is with low fat dairy. So if you can tolerate a high fat Greek yogurt, like a full fat Greek yogurt, that's a really good way to increase your protein and get those healthy fats in. Nuts and seeds are fantastic for the skin. So, for example, pretty much every night I have a bowl of full fat Greek yogurt on no sweetener, no flavor. I just put berries. So, raspberries and blackberries are going to be the most beneficial, but I also love blueberries and strawberries because they're still relatively low on the glycemic index. I do pumpkin seeds, I do flax seeds and chia seeds. So, I'm getting that extra healthy fat in there, fiber. And it's like my little dessert. Sometimes I'll even put like some keto, like chocolate chips that are sweetened with monk fruit if I want that kind of chocolatey kick to it. So there are so many really healthy foods that you can eat for not only overall health, but also for your skin health.
What about sardines? I am a big sardines fan.
Yes, I
I
love
think I'm
canned
like the
fish.
only one.
No, no,
Yeah.
it's so good for you. And actually, my daughter is 2.5 and she loves sardines and it makes me so happy.
Stop.
Yes. But I mean, at that age, they love like, if you start it early enough, they'll eat whatever you give them. So I just like
Yeah.
started from the get go giving them to her and I'll just rinse off because they can be a little salty. So I'll rinse them. But yeah, I love sardines for skin health and just overall health as well. And I'm so glad that she likes it. It's like my pride and joy to
That's
see her eating sardines.
honestly, like my husband hates them and he actually hates the smell. So and I eat them like 4 times a week. Like
That's
I am like
amazing.
the biggest fan. And he has to like leave the room when I'm eating them because he like wants to throw up by the smell alone. And so
Yeah.
I'm like, man, I really hope that my daughter likes sardines as much as I do. But I ate them so much when I was pregnant with her. So I'm like,
Hopefully
surely,
she
which I
will.
don't think there's any
Yeah,
science to
I
that.
know, but
But
it's still funny.
it's still funny. So hopefully I can follow your example and get her to eat the sardines as well.
How do you eat
Well,
them? Like, do you eat them right out of the can or do you have recipes that you love?
I can't eat them right out of the can. So people get really freaked out when they hear about sardines, but I get the boneless, skinless kind.
Okay.
So you don't have to pick out bones and they don't like have the heads or anything. They're just like fillets. Like if you open the can, it like looks like a can of tuna. So I think that's like where people get freaked out is they're like, I don't want the like little tiny fish that they picture like their grandpa eating on a sardine
Yes.
cracker. No, it's like a fillet of fish. And I put it in Greek yogurt. I make like a sardine salad. So it's Greek yogurt, celery, pecans, apples, and artichokes.
Ooh,
And you can like do it on some toast or whatever. It's honestly, I eat that like 4 times a week because you don't have to cook. You just open the can and flake it
just
directly,
assemble. I love that. I'm going to have to
assemble.
try that.
It's so good. How do you eat them?
I eat them right out of the can. I just
Oh
pick
my
out the
gosh.
pick out the bone from the middle. And usually I'm eating it when my daughter is. And if she sees them in the fridge, she wants them. And I can't remember the brand I get, but they'll put like peppers and stuff in the tin. So there's like some flavor already in them,
Yeah.
which is helpful.
Yeah. It's like not so fishy. It's so funny.
Yeah.
People are so afraid of them. I think it tastes better than tuna. Like I think it's like if you like really salty foods, which I do,
Mhm.
I mean, I think they taste better than tuna. So big
Yeah,
fan.
I mean, I'll eat just about everything. I grew up, my dad is Greek and like so very like Mediterranean diet. We just always ate that way, like lots of fish, lots of vegetables. So I'll eat anything, and I think that that helps. But sometimes I do forget how off-putting that can be to some people.
Same, same. It's like so normal for me now.
Yeah.
The Mediterranean diet, is that something that is science based as far as like improving your skin? Like I hear about like the olive oil and things like that. What is the science and legitimacy to that?
I think it's so interesting when it comes to the Mediterranean diet. I just had a conversation with Lily Nichols. She's a registered dietitian about this and how kind of as a society we've run with that concept that like the Mediterranean diet is the most healthful. And when you look at Mediterranean countries, they all kind of eat a little bit differently, which I think is interesting. Like what actually is a Mediterranean diet. But to answer your question about things like, I mean, we know olive oil, yes, is so beneficial. Nuts and seeds, which are common in that diet. It's I think of Mediterranean diet as like high in fish, but there is other animal protein too. Lots of fruits and vegetables. So I think it's kind of common sense to me. It definitely leans a little bit. It leans whole food for sure. I mean, we see a lot of whole foods in the Mediterranean diet, but as far as like, is it in the research the most beneficial? I'm not so sure that there's a ton of data to support that, but we do know that it contains a lot of the type of foods that we already recommend, like I mentioned earlier.
Yeah, and I think people love it because they're like, Mediterraneans drink a lot of wine, so that means
Yes.
wine wine is good for me.
Yeah, that's
What
so
is your
funny.
stance on alcohol in skincare?
So we do know that alcohol can wreak havoc on the skin. It's certainly beneficial for the skin to have a diet that is low in alcohol. It's something I see on my patients that have that quote unquote hard lifestyle that I was referring to earlier. You can absolutely see it on the skin when somebody drinks a lot of alcohol. So, and I'm someone who loves wine. Like again, I grew up with my dad being Greek. It's normal to have wine with dinner every night, so it's something that I've had to adjust in my own lifestyle. So I'm somebody who, number one, binge drinking for sure. Like you got to cut it out when it comes to your skin health. And that's something we can see, right? Like next day, you look in the mirror after a night of too much fun and you can see it immediately. Your skin is dehydrated. It looks more sallow. It looks like it might be sagging more. So we see all that. That's not something I even need to tell you because we've all witnessed it, right? So for sure, if you can cut back on the binge drinking, that's most important. And I think cutting back altogether is important too. Is it going to be harmful for you to have a glass of wine every now and then? No. But again, getting back to the sugar conversation, however we can limit sugar in our diet is also going to be really important for skin health. So
Yeah.
really the answer is little to no alcohol is going to be most beneficial for skin health.
It's crazy. I look back at pictures of myself in my 20s when I was binge drinking a lot. And I look like a different person. Like
Yeah.
my face looks so much more puffy and inflamed. And now that I drink so much less, you can see it in my skin. Like it is wild.
You know,
And it's
there's,
like,
go ahead.
go ahead. No, go ahead.
I was going to say there's that whole joke about how like millennials are aging backwards. And I think that has a lot to do with it. You know, in our college years, there's so much partying, staying up late, so much drinking that we do look older in those photos because our skin was just hanging on by a thread because of the lifestyle we were putting it through.
It's so true. It's like shocking to look back. I'm like, wow, that is crazy. And I also am like, I've probably figured out how to do my eyebrows a little better and
Yes,
like,
all those
the makeup's
things.
better than it was, like all those things. But this is so fun. I love this topic. I learned a lot. Can you tell me where our listeners can find you? I know people are going to like be curious about the products and stuff that you recommend. Do you have any resources for that? Tell us all the things we can work with you, everything, your
Yeah,
podcast.
absolutely. So I'm at Amy Koberling on Instagram and TikTok. My podcast is called Skinthusiast, the podcast. I interview a ton of different skin, health, wellness, even hair experts and cosmetic chemists, like I mentioned before, just to try to give you the most evidence-based information when it comes to treating your skin. And then my website is skinthusiast.com. And there I have a few resources. I have like a whole hair guide and a whole skin guide that can kind of walk you through how to get started, what products to use, because the biggest misconception in the industry, especially when it comes to social media skincare, is that one product is suitable for all, and that's just not the case. So it can be really difficult to try to get your skin information from social media because you have no idea, like, what's that influencer skin type? What are concerns? You know, is this going to work for me? So really understanding your own skin type is the first step. And then you can start to curate a routine that's really going to make impactful changes on your skin. And as I mentioned, I'm somebody who likes to keep it pretty simple. So that's usually evident in my content too. So if you're somebody who's really overwhelmed, I think the website's a good place to start because it can kind of simplify things for you a little bit.
I love. And I am about to go on your podcast. About to record an episode. So everyone's going to have to go over to your podcast and listen to that. And then all of
Yes.
your other content. You do awesome content on Instagram and TikTok. Thank you so much for being here, Amy. This was so fun.
Thank you for having me. I can't wait to chat.
Yay. All right, listeners, we will see you all next week. Same time, same place. Bye for now.